I would consider the Tevis Olympic quality. I've always said that, and I've said that at the board meetings frequently when I, as a board member for Western States, said this is the gold standard. This is the gold medal of endurance riding, and we have to make sure that we maintain the integrity of the ride and that we keep it as the gold standard. You know, and that goes back to the question you asked earlier about the buckle. What does the buckle mean? That buckle is a gold medal that we all wear if we're fortunate enough to have finished the ride. And whether we're first, last, in the middle, no matter what kind of day we had, I mean, that is the gold standard and the Olympic level standard. And Olympic level endurance riding base themselves on the Tevis. And they base themselves not on the recent Tevis, but on a few years back when we still had the weight requirement. And they incorporated that as part of their way of establishing a fairly level playing field. So the difficulty of the ride, the distance of the ride, the weight requirement, the time requirements were all the things that the international riding has adopted from Tevis.
Good afternoon, Erin. I'm so excited to be here today. We're going to be talking about the post-ride exam after Tevis, right?
Fantastic.
I'm super excited. I'm going to kick us off with a little bit on the veterinary's perspective, and Erin is going to talk about the rider perspective. So we're going to learn a lot of fun things about the aftercare for Tevis today. Something to think about, the finish line doesn't mark the end of the physiological stress for the endurance horse. It marks the beginning of the recovery assessment, which is why we have so many wonderful veterinarians on the Tevis crew. I'm going to read to you the statement that Tevis has of what is required. It is a mandatory that not earlier than 1 hour nor later than 2 hours after the rider's completion at the vet check at McCann Stadium, the horse be presented to the ride veterinarian for a post-ride final evaluation of the metabolic stability and general welfare of the horse. No trot out is required, and the results do not affect completion. However, failure to present the equine for this mandatory welfare check is grounds for disqualification.
Can I ask a question?
Yes, please.
So I'm new to endurance riding.
Yes.
And I've never done the Tevis before.
Yes.
So I'm that rider.
Yes.
And I'm used to a half-hour post-check.
Yes.
So I'm going to trot my horse out and do the whole thing. But when I come back in 2 hours, that's not going to get me pulled, right?
Very much so. What's unique about this one is that Tevis has been on the forefront for horse safety, and in 2009, Greg Fellers instituted this special post-ride exam. Has no effect on your placing. You have completed. Congratulations, you've done it. But we are there to make sure your horse has a safe recovery on the way home. That is what it's for. And because of this, since 2009, the Tevis veterinarians have found and saved multiple horses' lives. So it is a wonderful way to make sure you can continue having multiple fun rides with your horse.
Here's the main point. The veterinarians are here as advocates for the horse, period. You know, we're here for the safety of the horse. Yes, we want to help the riders, encourage them to finish and so on, but we're here primarily for the horse. And making sure that people, you know, some people are more competitive than others, and they push it a little too much, you know, and so on. And we have a full set of parameters that we go through, from the cardiac recovery index at every check, and mucous membranes, skin tenting, gut sounds, and so on and so forth that we look at. And again, I think all of us that are involved with this are passionate about it, and we want to be friendly with the riders, but and encourage them, frankly, but as long as they're taking good care of their horse.
So if I come back in 2 hours and I bring my horse, and maybe she's a little colicky,
Yes.
then she would be able to be treated.
Yes.
And I've still completed the ride.
You still completed the ride.
But my horse is being cared for properly. So
Yes.
that's the reason for that 2-hour post-check. So once that adrenaline's down on the riders and the horse, and they've settled a little bit, then if they're not feeling perfect,
in a couple hours, it's an opportunity for you guys to make sure that my horse is okay. Because that's,
Yes.
at the end of the day, it's about your horse being okay.
Yes. And like I said, because Tevis has found ways to ensure the safety of all equines, we'll make sure that you try to get home as safely as possible. Yeah. I think we all understand the purpose of this veterinary exam. What's unique about it, like we said, that there's no trot out. So we can come to you if you're in the barns or wherever your horse is. You can walk the horse to a veterinarian, and we can evaluate your horse statically, meaning there's no trot outs, but we're going to make sure that they're metabolically stable. So yeah, I have a few more things to say about that.
Sure.
Okay. As you know, it's a lot of hard work, and congratulations, you've completed 100 miles. Things that can go wrong are dehydration. That is one of the biggest things that we see, as well as the dehydration effects on the horse. So dehydration, if we have maybe it was fine at the finish, but an hour or two later, you have that skin tent. If it stays tented, I think this is a valuable piece of information. If it stays tented, that means it's 4% dehydrated. What 4% actually means is 4% of the horse's weight. So if they're a 1,000-pound horse and you're 4% dehydrated, that means there's 40 pounds of water loss.
Wow.
So that's a lot to catch up on, and it can have other effects. Another example could be that you have great gut sounds at the finish, maybe on the touch of hypermodal. What actually can happen is shortly thereafter you can have a crash and have no gut sounds, because when you're having a metabolic event where all the blood has moved from your intestines to your muscles, the intestines become hypermodal and then they become absent, and that's what we call ileus, where the intestines stop moving, and that would cause a significant amount of colic. So we will treat horses for colic if their intestines stop moving. Those are the primary things. We're going to be looking at their mucous membranes, like we have looked at your horse throughout the whole ride, checking your jugular refill, skin tent, intestinal motility, as well as muscles for tension. We're not going to be trotting you out, but if we find some really tense muscles, we might find some tie-ups, things like that. So, yeah. But in general, the most important things are that I'm going to read this one because it was a good quote. A successful finish and is more than a completion. It's a horse that recovers safely and confidently, and the post-ride exam is there for the assurance of that success. Overall, the most important thing is safety above all else. That is a Tevis mantra, and I am so proud of the Tevis team to save many more horses than we would have otherwise not saved. So, yeah.
And there's been thousands of horses. She's only 2 today. There's been thousands of horses that have finished the Tevis successfully since it started in 1955. It wasn't an official ride until the early 1960s. But if we were to count how many times a horse has started the ride, not including the ones that didn't finish, but just like every horse that started the ride, we're talking about thousands of horses over decades that have successfully completed the ride. Many of them have completed it multiple times.
Yes,
and
absolutely.
So with the proper care, which includes what the veterinary team does along the way to assist the rider and the horse to be successful, it's a pretty amazing accomplishment. And the fact that horses come back and do it again and again is really quite remarkable.
Yeah.
So, hi, Mems. Well, I have another question.
Yes.
So I've done my half-hour recheck, and now I come back to do the 2-hour.
Yes.
And I want to wrap my horse's legs as soon as that half-hour check is done and you've taken my vet card and said, congratulations, you've completed. Is it okay for me to wrap my horse now?
I think that's a good time for you to take care of the horse best for you.
Okay.
Yes.
So that would be a yes.
Yes.
Wrap your horse's legs once that final vet exam is done. In the past, Bobcat Productions has filmed segments on wrapping horses' legs, so you can review that. And we've also, Dr. Kelly and I have done a complete educational video on vetting your horse out. So there's a lot of really good information there. So I would encourage our viewers to also review both of those videos, one about leg wrapping and the other one about vetting your horse out, because I think it really ties well into what we're talking about today.
Absolutely.
So this is Memory. She's just here to look good and drive me crazy. I'd like to talk about what's on the table. So let me see if I can tie her back
swap
up.
with you. I'll do the horse exam over here.
You want to hang on to her? She will bother you a lot. Yes. She's kind of a silly horse that way. Okay, so I have put together kind of an ensemble, if you will, of different ways and different processes for wrapping your horse's legs, because wrapping the horse's legs post-ride is beneficial.
Yes.
Provided you do it right and use the right information and the right products. Okay. Right. So let's kind of start over here on the left side of the table. These are actually what are called a cooling boot. They're a big, thick, fluffy boot. And they can also kind of operate, if you will, like a shipping boot. Oh, and they're nice and dirty, so we show that they're useful. But they have this mesh inside, and you can dunk these in water and get them nice and cool, put them on there, and they will provide that kind of cooling effect, especially if you have some ice in the water or a little bit of alcohol or something else. But keep in mind that once it's not cooling anymore, now it's hot. Fair enough?
Heat, yes.
Yeah, so if I want to cool the leg down, I'm going to put this on for a little bit, maybe 15 or 20 minutes, and then I'm going to either redunk it and get it cold again and take it back off. Because if I just leave it on the whole time, it's going to actually warm itself up, and the water will help hold the heat a little bit.
Right.
Kind of insulating. These are called chucks. And you'll see a lot of people like to use these because when you wrap over them, because they have this plastic impermeable backing, whatever you wrap with doesn't go through the chuck. But the problem with this is for sweating. And sweating, maybe I should have you explain it. I mean, in layman's terms, sweating the leg means I'm trying to get rid of inflammation in the leg.
Yes,
but
that's one way to do that.
That's one way to do it, is you wrap this, and because this will hold heat, that's not a good post-ride option.
We don't want heat post-ride.
So this has I brought it out here just because I've seen people post-ride with a chuck, and just to let you know that that's not a good plan, because now you're holding heat on the leg, and your goal is to reduce heat and provide support. So just so you know what that is. This is a fairly common ice boot system now. You freeze these ahead of time. You notice this one's really clean because it's always in my house, because we use it on our back more than it goes on our horse's legs. But it has these little squares that are frozen on the inside, and you wrap it around the horse's leg. The nice part about these is they're very tall. So you're going to get really good coverage on the leg, if memory will accommodate me for a moment. And you can see, and you can buy these in different heights, but you can see that when I put it on, it will be very tall. And if I let it drop down, it will go and cover her pasterns as well. Keep in mind, these are very cold. And some horses can be really aggravated by having that really cold surface against their legs. And so it's possible that you may need to throw some kind of very light bandage on ahead of time.
Yes, please.
Before you put these on. Try them out at home ahead of time. Don't go to the ride and then decide, I bought these fancy schmancy ice boots and now I'm going to use them for the first time ever. No. Because if she's agitated by these ice boots because the ice is too cold against her skin and uncomfortable, she's fluffy right now, it's wintertime. But if it's summer in Tevis, she's slick down there.
Yeah.
So if it's agitating her and she's pawing, she's digging, and she's not wanting to eat and doesn't want to drink, and she's irritated, now I've created a new problem trying to solve one. So always make sure you practice this ahead of time. See what your horse will tolerate, and if need be, put a thin layer of something underneath before you apply the ice boot. And this is similar to these cooling boots, that after about 20 minutes, they need to come off. Because after 20 minutes, of cooling, then the body goes too cold and it starts cranking up the circulation, trying to warm it back up again. So you end up kind of canceling yourself out a little bit.
Do you like to put them on for 20 minutes and repeat again, or just on initially after that 2-hour mark?
It depends on the situation. Like if I feel like my horse needs more icing, I might do it like once an hour.
Once an hour. That's
Once
great.
an hour for a while. And then after about 4 or 5 times, say, okay, I think we're good to go on that. All right,
Yes.
Nemos. So let's talk about, so this, all of those, this one you would obviously don't want to use for endurance rides. So let's huck that out. But these you can take the way they are. Now we want to talk about, I want to wrap my horse's legs after the ride.
Mhm.
My main go-to is clay. So this is clay. There's a lot of different brands out there. I'm not endorsing any brands, but this is a very thick paste. And you're going to slather it on really, really thick. Okay, so I always get a disposable glove. Unless you like the smell of menthol clay in your fingernails for a week. And I'm going to grab it like this and I'm going to paint it on like peanut butter, like that thick, down from the knees down to the pasterns, from the hocks to the pasterns, and then wrap over the top of that. Okay, so you can, there's a lot of different brands of clay out there. The nice part about clay is it's going to pull inflammation out of the leg, and it's cooling, and it kind of casts the leg a little bit, gives them extra support. You can use clay with a quilt and some kind of a turf knit afterwards, where you put the clay, you slather it on the leg, put the quilt on, you wrap with some kind of a bandage afterwards. It doesn't have to be reusable. It could be vet wraps. You leave it on for 24 hours.
I prefer the no bows and standing wraps, but essentially what you're comfortable with is the most important thing, because wrapping takes a lot of experience. So
Practice.
use what you're comfortable with. Don't practice for the first time after the ride.
Yeah, good advice. You have cotton. Some people like to use cotton and then they peel it off. They put it around the leg and then they can throw it away afterwards when it's all covered with clay. These are, again, these are disposable wraps. They're like the cotton roll, but they're kind of between the cotton roll and the quilt. They actually have a form and a shape, and you can cut them to size. And again, these are disposable if you don't want to deal with that.
Sheet cotton's one of our favorites. Yeah.
Yeah. Holo wraps. Holo wraps are hot. I don't know if I need to say that twice. Holo wraps are hot. If I put clay on and pull a wrap on there, weirdly, this does not breathe as well as these together or these together or these together. And so this is going to create a lot of heat and is not really a great option. They're easy to use and people think, oh, they're already cushiony and I don't have to add an extra layer. But you're not trying to create heat, you're trying to get away from heat. So be careful with that. Now, mineral ice. I love mineral ice too. Mineral ice is that cooling gel, right? It is exactly what it says, mineral ice, but it's also menthol. You never wrap over menthol because you can blister and it causes heat. But you put this on and you let the horse have air to their legs, it has a great cooling effect. So if you're like, I don't know about all these wraps, Erin, you're cray and I'm not going to do it, go to mineral ice.
Good hydration over here.
Well, she's probably in heat again, so then there's that. This is the blue gel. I don't know if you can see that very well. It's menthol. It's easy to just slather it on there and let the air hit it, and it will cool the legs down. I have an old remedy that most people don't know about. It's called apple cider vinegar. Apple cider vinegar will reduce inflammation and bruising, and it's a topical analgesic, so it's actually not legal to use during the ride.
No,
because it has the ability to reduce pain. It gets absorbed through the skin and will dial down the pain and inflammation. But if their horse has any abrasions at all, if they've got any cuts, any scrapes, if their boots have kind of irritated, the skin looks kind of reddish or angry, do not use cider vinegar. because your horse is going to be like tap dancing all over the place and really upset with you. I have a couple other ones. This is a go-to that I've used for years, Bigeloil oil. But again, I use Bigeloil oil like in between trainings to do just a wipe down on the horse's legs and a rub on their legs if there's no abrasions, because again, this is menthol with alcohol. It's going to burn like hell. And so that's okay, but you would never wrap over Bigeloil oil either. So if you give something a sniff and you're like, we sniffed this one earlier, and I was like, woof, alcohol, like yowza,
No.
or menthol, and like, all of a sudden my sinuses are clear and I feel so amazing. Then you're like, that's not a wrapping type of liniment to use. You want something that's really benign and easy. So I'm going to ask you now, Dr. Kelly. I'll take her back since she's so much fun, and I would like you to talk about Banamine and Butte post-ride, because, we're all taking vitamin I at the end of Tevis and thinking everything's great, and I'm going to take some ibuprofen and Advil and Aleve or whatever to dial down my own discomfort. But what about my horse?
So horses are unique creatures. Yes, thank you. Horses are unique creatures in that they are pretty resilient. However, we never want to give these classes of anti-inflammatories, which are can cause renal damage in spite of dehydration. So we don't want to cause further insult to kidneys while we know that they're going through a dehydration event. So this might be something that you would consider afterwards, maybe a day or two later, but not immediately after the event. We don't want to tax their kidneys already than what they have. There's lactic acids going through their body from their muscles. We want to stay away from these products. If they need to be done, it would be something you would speak to with your veterinarian, and if it was needed to be given, if at all, we'd go through after IV fluids have been given or enough hydration has been restored. So these are very careful drugs to be used. They're not just easy because they're quick and easy and make you feel good. They have serious implications.
Yeah. Okay, so I think the last thing that Barbara White, who is a member of our executive committee with the Tevis, with the Western States Trail Foundation, asked to have us talk about, what about taking my horse home after the ride? Gonna have to move her again. I'm taking the horse home after the ride because I've done my 2-hour check. I've got my leg wraps on if I'm using them. I did bring a cooler here because, horses might need a cooler even though it's warm and it's, summer, just because they've worked really hard and they might not have enough energy right now to put out to just kind of maintain their own body heat and feel comfortable. But how do I get home now? What's my best plan?
So from the rider's perspective, most stay that first night, correct? Are there a handful that go
home? It's hard to say. Like really local riders will oftentimes come home fairly early. Mm-hmm. I'm more concerned about those riders that have 4 hours or more travel time, or even multiple days to get back home. What should they be planning for and trying to do?
I would wait at least that first day, because when you're in a trailer, you have a water loss, so you're going through more stress. And what is it? An hour in the trailer is how many is cantering for an hour?
I think it was. Okay, now I gotta think about it.
Sorry.
I think that an hour's worth of trailering time is the equivalent of a horse traveling like 6 miles on foot at a walk.
Yes. So that's my point, is that when we pick up right after doing 100 miles and then ask them to do more work standing in a trailer, that whole time they're microbalancing and they're using their whole body. So to have at least enough time to recover your hydration status and feel comfortable to get in a trailer to travel long distances and still be able to hit your hydration status along the way is something to consider. So distance, how far you're going, how many stops you're making, you should at least stay for that first 24 hours minimum.
Mm-hmm.
Yeah.
Okay. And if you have leg wraps on and they've been on, let's say I did my clay and it's been there for 24 hours, should I take that off and go on to something else?
I always remove any clay things after 24 hours.
Okay.
Yeah.
So 24 hours in clay and then rinse the legs down and wash them really good.
Wash them off really well.
Wash them really, really good. And now you can go home with your shipping boots or a dry standing bandage if you wanted to do a dry standing bandage on the way home.
Yes. I am so proud to be part of the Tevis team because Tevis is such a unique endurance event that they have been on the forefront of equine safety. And every new Tevis, they are finding new ways to protect horses. And what's so wonderful about that is this post-ride exam. They have found ways to keep horses safe in the long term for future events. And whether it's the post-ride exam or different safety measures along the trail, I'm proud to be part of the Tevis team. Yeah.
And that's why they have things like you see on Tevis, a lot of horses on IVs.
Yes.
As a preventative.
Yes.
And I've been around the Tevis since the first time I saw it was 1976. And so I have seen that the horses that are put on IVs as a preventative has made things a lot easier for the recovery of these horses that are just barely beginning to be metabolic. They're not in trouble, but they're just on the bubble to where that extra hydration is really good for them.
Yeah.
So that's exceptional. And I know that we've had schools like UC Davis who has embedded teams and kinds of research. At Tevis. You could there was a little bit of some of the research they've done on Tevis.
Yeah, there was a ton of research. I think about every other year there's a new research team. One year was from Minnesota looking at intestinal motility while on the trail. There was one year that they were doing blood work pre and post to see what changes happen in their blood work and how we can help support horses in the future. I think it's absolutely spectacular, the wonderful support we have from Loomis Basin and UC Davis, that we have veterinarians every 10 miles ready to set up fluids and help your horse, but also they're at the very end. They're just going to stay until the very end and make sure that your horse has the best option to remain healthy the whole way through.
Mm-hmm. Yeah. I remember one year they did a study, I think it was UC Davis, and they weighed the horses.
Yes.
And it was really fascinating to actually know how much these horses weighed before the ride, during the ride, after the ride, like 24 hours after the ride. It was fascinating to get that data and that information and kind of then say, now what does that tell us about equine health?
There is a fantastic part of that information helped that if you were traveling however many days, you need to have at least a similar amount of days before the start of the event to recover the fluid loss. Because if you start the event at a fluid loss, you will for certain have trouble. So that weight was, like we talked about, 40 pounds of water loss. And we can see how many pounds of water loss they've had throughout the event. It's important to set your horse up for the best success possible. And that was through that wonderful research that came out of having so much availability of people here and horses and great trails.
Yeah, I think one last question that I can think of is that people talk about the elevation on Tevis with horses.
Yes.
To what extent is elevation really a factor for horses on Tevis?
That is a good question. So, I think because it's at the beginning and your oxygen levels. So if you were only ever doing flat land training before you do this, was it 5,000 elevation gain?
No, Watson I think is close to
9,000. So if you've only ever done flat training and then doing hill work, this ride won't be good for you. You need to be able to have the oxygen reserves and be able to do that. So it doesn't mean you need to go up 9,000 feet, but you do need to be able to climb X amount of hills. So obviously there are certain places across the country that don't have large hills, but as long as you do large hill work, you don't have to be elevation trained, but as long as you're athletically prepared to do the hill work, that's more important.
And by the time we get to Auburn, we're down to about 1,000 feet.
Exactly.
Or give or take. So that's not a bad thing either. So going back to talking about elevation, the way I was taught about Tevis when I was a kid, 10 years old, I won't date myself, but it's like a lot of decades. So I was told you ride the first 10 miles the way you want to ride the last 10 miles.
Yes.
And in that first 10 miles of Tevis, you are going to hit the climb to Watson Monument. You won't quite be at Watson. You'll be almost there, but you are going to hit it in that first 10 miles. And a lot of people rush that section because it's a big wide road and they think, oh, I should just roll. It's not the hill that you trot if you live near the coast and you ride the coastal range and you have, you know, a 2,000 foot climb from the beach to some elevation. You are going from 7,000 feet to almost 9,000 feet in that same distance. And so it's important to keep that in mind too, because if we're talking about post-ride care, I have to be thinking about post-ride care in the first 10 miles.
Yes. Yeah.
And be mindful of that, because if I don't, I can kind of screw it all up right there in that first 10 miles.
Right. How would you say, though, because every horse is different, right? There's some that are very fresh, and you have 100+ horses that are very excited to get on the trail. How do you rate them on that first hill climb if they're quote unquote chomping at the bit to go?
Well, I
Is
mean, yeah, because when you ride a hot horse, you're looking for the first hill you can find,
yeah.
because hills are the great equalizer. You're like, oh, please send a really long hill. Like, you're just really dying to send this horse uphill. Plus, when they buck, if they're going to buck on the uphill, it's not as traumatic as if you're on the flat or the downhill.
Yeah.
But from the time you leave the valley there, the Nisquaw Valley, and start up what's now called Palisades to the top, you shuffle a little bit at the trot or jog, and then you walk. You pull that horse up before the horse pulls up on their own.
Yeah.
Because if a horse is trotting uphill and starts going faster or cantering or breaking into the canter, or they're dipping their nose and their head way down, that's how they're telling you, I'm running out of air.
Yeah, okay.
I am running out of air and I can't keep up. And when they canter, they can pull more air into their lungs, whereas in the trot, it elevates the respiration rate. So pull the horse up before they start getting faster or breaking to the canter or dipping their head down. And even if they're anxious and they walk the length of this dressage court, 200 feet, and then they're getting sideways, like, come on, now you can trot a little bit again, and then pull them up before they pull up.
Yeah.
Because that way you can navigate that section. And as you get into that last pitch going into Watson Monument too, it's probably not a bad idea to just walk.
Yeah.
Like, once you leave the spot, what they call high camp, which is where the last ski run thing is, the end of the line for the ski lift, from there up is when you're really in that highest elevation. And at that point, you should probably just walk. You don't have to get off and walk. I've seen people get off and walk and then they get beat up by the lack of oxygen. So just walk and get up over the top of the hill. And then on the backside, it's so technical, it'll slow you down. But you're going to start losing elevation and kind of getting away from that little bump anyway.
So it sounds like rating your horse at the beginning is important, like you said, to have the same ride at the beginning towards the end. That way you have enough gas in your gas tanks for the end as well.
Absolutely. Yeah. You want your horse, and it makes you feel good. You have a lot of pride and humility when you're coming into Auburn and your horse has still got juice in the tank.
Yes.
You feel like, wow, I did a good job today. So, and it just makes you feel good and makes sure your horse's ears are up. You want them to be, ears up and happy when you're coming in. And don't be afraid to stop. Just telling you, because aftercare doesn't mean I finished the ride.
No.
Aftercare could be I got pulled.
Yes.
10 miles in, I got pulled crossing, going under Highway 89 and not even 10 miles into the ride. So aftercare is aftercare is aftercare. So that's the other thing. Keep that in mind. This is not just for people that finished the Tevis. You tried it, maybe didn't make it to this time to the finish line, but you still have an aftercare protocol to follow because you've asked your horse to do a lot that day.
Yes, absolutely. Yeah. Well, I think this is fantastic information to help people be prepared, know what to look for, and get your skills up before the big day. I think this is great information before you get to the Tevis place. This is fantastic. Thank you again, Erin.
You're
wonderful.
Welcome. Yeah, it's great. I'm Erin McChesney, and this is Dr. Kelly Torrisi from Auburn Equine, and you've been listening to Tevis Talks. Again, remind you to please review the videos on wrapping your horse's legs and also how to do the vet check, because we did that one together too. There's a lot of great information in there.
Yes.
And we want to thank Bobcat Productions for his continued support of the Western States Trail Foundation with all these amazing videos. And we look forward to seeing you on the trail this summer. And have a great day, you guys.
Thank you.